on time. But I'm always around. I'm happy to meet you with honor. Maiga Ayub Hussein is my name. I'm an epidemiologist from Universitas Indonesia, from Universitas Diponegoro, which is an Indonesian-based university. I also hold a bachelor's in nursing from Kampala International University. I'm the CEO, Nexus Center for Research and Innovation. We've mentored and trained young career researchers through research and innovations, and we've also developed research for different organizations. And one of them actually is what we shall present today. I'll rely on this presentation on one of the textbooks we wrote and published, which is One Health Basic Application. And it was under the supervision of Professor Agus Wandono, who is the One Health coordinator, Indonesia, and also Ibu Dwi Sutiningsih, who is also a professor in Universitas Diponegoro and also Gadjah Mada. That book that we are going to share today, it was launched in Uganda. I don't know whether you know Professor Bazeyo William, who also participated in the launch. So for today, that is our topic, and that is my introduction as Ayub. Indeed, One Health is a concept. It's new in the 21st century. And for this discussion today, we'd like to see how best it can be applied in cancer management. It could be the one of its kind presentation that you're going to listen to and get inspired. So let me start with this disclaimer. When we meet patients of cancer, they have their worries, they have their, they at times verbalize having lost hope, and they always wish to God to be better. And that's always what some of them say. I don't think I'll be better, but I pray to God to help me. But they go along and also ask you as health personnel what causes cancer and what is cancer. So the definition I have here, I got it from one of your doctors, Dr. Jackson, who actually had a presentation and defined cancer as a disease stemming from abnormal changes or alterations in the genome. A genome which is a complete set of genetic material. Give an example of DNA. And it contains instructions, perhaps for growth, development, and functionality. So for cancer cells, this genome is altered, and then you have abnormal cells multiplying without control. That is for the definition of cancer, which I'm very well aware that you know very well. However, for One Health, it's an approach that recognizes the connection between human health, animal health, and environmental health. Indeed, to curb infectious diseases, to curb cancer, we shouldn't look at it as a public health, public specialist concern. We should look at it in an environment that it actually concerns environmentalists, it actually concerns animal or veterinary officers, and also concerns public health officers. So a One Health approach actually calls upon all these specialties to come on together and see how best they can curb, in this context, cancer. So basically that is what One Health means. Statistically, in Uganda, as of 2022, Uganda registered over 35,000 cases, 35,968 cases, new cases of cancer, and cervical and uterine cancer actually being followed by Kaposi sarcoma, which is an HIV-related cancer. I could stand to be corrected. Right. So the prevalence of cancer in the 5 years is around 77,028. And also registered number of deaths totaling to 24,629. So you're really looking at these statistics, it is a burden. It's a burden to the nation, it's a burden, it's a global burden. But now for the case of Uganda, where cancer it's one of the emerging actually diseases, it worries us. However, for this presentation, we shall really understand that Uganda Cancer Institute is not actually the one in this game, is not the one at play, but we should actually see how best we can consolidate the partnerships and collaborate with other partners in seeing how best we can curb cancer. One Health, from the background that if there is close contact or uncontrolled animal and human interactions, also environment, there is increase of risk of diseases. Give an example of how COVID was, with the background that they thought perhaps COVID emanated from maybe bats, so that is animal linkage, and then it got to be spread through by person to person, that is now human to human, leaving alone the animal to human interaction, and also in the environment. That's why they put the distance, meaning that the environment had an impact on the COVID virus itself. So for One Health approach, it addresses these emerging health threats, and it also recognizes that there should be coordination, there should be joint efforts across all these sectors, Ministry of Health, Ministry of Works, Ministry of Defense, to really come up and then see how best they can curb, in this context, cancer. So One Health is a collaborative multi-sectoral approach linking human, animal, and environmental health. For the specialists, it calls upon public health officers, environmentalists, and veterinary officers. Since majority of the cancers and majority of the diseases actually emanate from the animals, if we don't collaborate with the veterinary officers, you can't actually understand now the origin of such diseases. And also some of them actually emanate from the environment we live in. Some cancers emanate from the air pollutions. And if we don't collaborate with the environmentalists and the perhaps sectors concerned with the environment, Uganda Cancer Institute, you can't stand alone to really fight cancer. And that is what One Health approach calls upon. At operations at the local, national, and global level, and with an ultimate goal of optimal health outcome. So the book that right there on the screen, One Health Basic and Application, was a book that I co-authored with Dr. Saidi Ntambi, supervised by Professor August Wandono and Professor Dwi Sutiningsi. So in this book, we talked about the 4 C's of One Health, which are collaboration that is working together in this context, bringing about all these sectors working together. You've seen how some cancers actually originate from the foods we eat. And you're a public health specialist. How are you going to actually now deal with agriculture? So it really calls upon some person specialized in that area to be on board. And coordination, which actually simply means that people should know their roles and responsibilities. I'm very sure we cannot have, depending on our specialty, we are very comfortable with some certain roles. So it really also calls upon the different specialties with the different special roles to cooperate. That is ensuring that all sectors are part of this discussion, actually sitting on the round table like this, where I'm an epidemiologist, Dr. Derek is there, and indeed to communicate, to share these ideas, to share how best you can curb cancer. There are many risks or risk factors that actually lead to cancer. And I've tried to see how best I could make them pictorial and easy to understand. And still this, the risk factors were also, we picked them, or we referenced Uganda Cancer Society, where we got some of the risk factors. So under lifestyle factors, which is human health now, under the One Health docket, there is a risk factor of poor nutrition, looking at the image side, where the gentleman right there is smoking, is having a burger on the side, is having also alcohol on the other side, and he also wishes to have a good health, okay? And so these are all risk factors: poor diet, tobacco use and exposure, lack of physical activity, and safe sexual practices. One of the authors actually talked about the sexually transmitted disease, that even the infections themselves, if they are not well managed, they can actually result into the abnormal growth of those cells, developing into now a cancer. So under lifestyle, sexual practices also could be the risk factors. So under environment, under environmental factors, a docket of One Health environmental health, we also picked out the risk factors such as air pollution, pesticide and agrochemicals, industrial pollution, contaminated food with aflatoxins. One of the authors, Elizabeth, actually talked about the high aflatoxins in the foods in Uganda, mostly grains. And there is really a linkage, a very high linkage of aflatoxins with cancer development. And you really see that as a public health now specialist, you may not be very well specialized or having expertise in now looking at this plant, the aflatoxins. However, they could be very well addressed by perhaps somebody in the environment or an environmentalist to actually look out for those particles within these stored foods. And that is indeed what One Health talks about, that we need to have all these teams brought onto board to really see that we curb cancer. The next risk factor which is, I don't know why this is not sliding, machine. The biological factors, and these we categorize them under infection, still under human health. The human papilloma virus that actually causes cancer, which is just a biological agent. The Helicobacter pylori that causes ulcers could actually now cause cancer. Brucellosis and other zoonotic infections could have an influence on the immune system relating, now causing cancer. Also, another risk factor could be the genetic defects. Their cancer now gets into being hereditary, and also as a result also to genetic mutations that also could be influenced by also environmental exposures. Give an example to radiations and toxins leading to cancer development. So in the One Health approach, as a public health personnel, you can look at these infections, but it may be hard for you to look at the environment, the pollutions, the pollutants, the aflatoxins. It may be hard for you to look at the linkage of animal, the beef, the pork. I'm a Muslim, but we can also pass it there. So you may not be in position to to have the expertise in assessing those foods, the animal food. But a veterinary officer could be in a very right position to actually assess and evaluate whether that food is suit or palatable for human consumption. And that is what One Health talks about or recognizes, that as Uganda Cancer Institute, you shouldn't work alone. We should call upon all these other sectors. Ministry of Health, under which you are, Ministry of NEMA, which is Environment, Animal and Agriculture Ministries. So this is the framework. Under the One Health framework for cancer management, this is what we developed, and I hope it will elaborate more on what I've explained earlier on. Under the human health, of course, with collaboration, coordination, and communication among the different stakeholders and sectors. Under the human health sector, key responsibility could be cancer screening, which I'm very well sure Uganda Cancer Institute does. Treatment and awareness. That could be now handled under human health. Under the responsible entities, we could talk about the Ministry of Health, Uganda Cancer Institute, Uganda Medical Association, other NGOs, and Uganda Cancer Society. So they could be in that position to handle that docket. However, when it comes to animal health, which has still a linkage to cancer, whereby there is need to monitor zoonotic infections and ensuring safe animal best food products. Now, this could be now an area that perhaps public health specialists may not have expertise, but veterinary officers could be having very nice expertise in this. And that now calls upon these other entities like Makerere College of Veterinary Medicine, FAO, Uganda Veterinary Associations, to now sit on the round table with the Ministry of Health and Human Health. The other concept of One Health, which is environmental health, where the responsibilities in curbing or managing cancer could be pollution control, safe water and food standards, and also reducing carcinogenic exposure. This could be perhaps maybe assessing the foods that we eat before they are put on the market. And this could be now the responsible entities under this could be the Ministry of Water and Environment, Uganda National Bureau of Standards, to assess to what extent the foods that we consume on the market are of good standard for human consumption. Public health and policy, under that sector, the responsibility could be cancer prevention policies, give an example of tobacco and alcohol, and also campaigns on HPV vaccination. And this now we call upon the Parliament, National Drug Authority, and Uganda Bureau of Statistics. You realize that some of the biological factors actually could result from poor management of some of the infections. And that's how best the policies could actually align. Give an example of the antibiotic use and stewardship. It is actually something that is actually resulting into antibiotic resistance, and there are less policies on antibiotic use in Uganda. Research and academia, actually what I'm doing right now is under that docket, that I'm trying to disseminate this information, that indeed we need to work with other entities, with other with the different specialists, with different expertise in this. Community and media, we should as well at the same time call on media to see how best awareness is created on cancer, risk factors, and best management at individual level and also at public level. We went ahead and also derived strategies, and these, indeed, it's not a one-man army. However, it starts with you. It starts with me. It starts with you in the audience. It also starts with those listening in on Zoom. That for us to see how best we can reduce the cancer risks as an individual and also at public level, we need to see that we have prevention and lifestyle change. That is promoting health eating. Not every food is good. And I'm very sure not whatever is sold in whatever markets, whatever nice structures is good, is palatable for your health. So in this strategy, look out for whatever you eat. Be cautious about whatever you eat and whatever you feed your children and your family in case you need them not to be culprits of cancer. Increasing physical activity. This could be under community-based fitness programs or even at individual level. Alisa, I appreciate Uganda Cancer Institute. The other time I was here, this room after the presentation was actually, the tables were put aside for physical exercise. I don't know whether the routine is still going on. Oh, I hope it's going on. I won't tell people what is happening in the audience. But it was a very nice routine that people frequently exercise. Tobacco control, this could be under policies, that we could have really strong policies on tobacco and alcohol use. And also eradication, if really you realize that tobacco is harmful. They even put a very bad picture on the package, rotten lungs, and then somebody goes ahead and takes it, which is still okay maybe for that person. But it is also okay that the people who manufacture the tobacco notify this person. So it's upon his or her will. Then also, under the strategy to reduce cancer at individual level, we can also look at vaccination, going in for vaccination, and also campaigns, expanding on free vaccination programs. And safe sex campaigns, that is promotion of use of condoms and any other devices or equipment that can protect you from sex that is not safe. And also screening for sexually transmitted infections, which I'm very sure is being done even here in Uganda Cancer Institute. Reducing aflatoxin exposure. This now could be done. By now, the public health specialists may not be having the expertise now to do this. But somebody perhaps specialized in agriculture, in food storage or nutrition could be very well suitable in assessing these toxins, because indeed they have a linkage to cancer development. And the other component could be environmental and occupational safety under the reduction of risks for cancer. Reducing air pollution. This could be perhaps done through enforcing clean energy policies. Gas is still quite expensive. How I wish if gas is lower by price, then we could have maybe less usage of charcoal. But in case gas is still high, we shall still have trees cut down, impacting on the environmental health, burning of charcoal, producing smoke, still environmental health, and then inhalation of those particles now going into human health and then causing cancer, examples like lung cancer. So regulating pesticide use. I don't know whether you've gone to farms outside Kampala, but I'm also a beautiful farmer. And I remember when we were leaving the farm last weekend, a brother of mine, Ali, told me that I'm going to grow maize. But I've been told there is a type of maize that actually the yields are very nice, but you cannot replant it. But I've also been told that that product, however good it is in terms of resistance to the pests and the diseases, it could be not healthy for consumption. But he told me that I think it is majorly planted by those who are looking at how best can we yield more without having losses. And what his option was, I think you plant this for consumption and then you plant for your own another type that is maybe palatable for human, for your own consumption. You've seen this where farmers of some animals, they can't actually slaughter them for their own consumption, but they put them onto the market. Sorry to say, I've seen some broiler farmers and they don't take the broilers. They can't slaughter them for their families, but they put them on market for us to consume. So indeed, we should watch out. And also this now goes to the different sectors that they should also keep a watch on evaluating, on assessing that these products before they are put on market for consumption. And in so doing, as public health specialists at this other arm of health, of human health, we shall be able to also be able to curb cancer, maybe at the right stages, and then be able to prevent and manage cancer very well. The other is improving water sanitation as part of risk reduction, where we improve on dumping of waste and also improving access to drinking water. At the same time, improving surveillance and early detection. This takes a contribution from Uganda Cancer Institute that we could expand on the surveillance. These statistics that I've actually showed here could not be actually the true statistics. It could be higher than this, not actually even lower, but I'm pretty sure it could be higher than this, because some of the culprits, some of the patients, some of the clients have no access to such facilities where actually data is captured and statistically brought to board. So, and if surveillance is improved, we can have now access to these services and also better reporting. And indeed, reporting results into better allocation of services and planning. The other is monitoring environmental carcinogens, which could be now done by environmentalists. And that is what One Health talks about, research and innovations. What should we take home tonight? One Health is a concept. It's an approach that recognizes that Uganda Cancer Institute under the Human Health arm cannot alone handle cancer prevention and management, but a joint effort with other ministries, environment ministries, give an example of NEMA, ministries, veterinary, agriculture, if they really come together on board with now health, that is now, give an example of Uganda Cancer Institute, we shall be able to prevent and manage cancer appropriately. Maiga Ayub Hussein is my name. And the disclaimer up there is, what a beautiful world where the humans, animals, and the environment care about each other. Where we don't cut trees for charcoal, but we have gas. Where we actually treat our animals rightly with the right drugs, and we actually consume the animals ourselves and not just prepare animals for the public, but they should be also ideal, and at the beef should be of standard to even your family before you even send it to our markets to sell the food to us. So that is the world that I wish we paint a picture where there is interlinkage, there is care about the animals, care about the humans, and also caring about the environment. That is a cycle. So we should look at that, and that is what One Health calls upon. For any other details on One Health, my contacts are right there. I still remain Maiga Ayub Hussein, CEO Nexus Center for Research and Innovation, and I welcome you all for maybe questions. Thank you so much.
Thank you.